to access your veterinary specific measurements, such as VHS, Norbert Angle, and tibial plateau angles, you need to have your exposure correctly labeled. For example, for VHS, you need that projection to reflect right thorax lateral. Similarly, on the pelvis, you need a VD, and for the tibial plateau angles, you need it to be a stifle. On those specific projections, your veterinary measurements come up under guided markup. And it will automatically be the correct one for that projection. And it's very simple to take these measurements. You just follow the instructions in this little panel. So here it's saying, indicating that we need to indicate the length of 5 vertebrae by picking 2 points. 3, 4, 5. Okay. Then we need to indicate the major axis of the heart by picking 2 points. That's usually your ventral border of your carina to your cardiac apex. And then we need to pick a point on the left-hand side of the heart at its widest point. Here. Next step, pick a point on the yellow line where it crosses the right-hand side of the heart. And here we will be given a vertebral heart score of 10.59, tells us if that's normal or enlarged, and saves that finding to the radiograph. If we would like to make these lines and the annotation invisible because we, for example, want to assess the parenchyma of the lungs and it's distracting us, there's a little function at the bottom called blank markup, which we can select, and it will then clear your radiograph of all the lines and labels, but the information is still saved to that specific radiograph. Let me walk you through the Norbert angle. So once again, it needs to be the pelvis VD, and then we get an option here of a guided markup. And just to emphasize how important positioning is here, this is not a perfectly positioned radiograph, but it is the best example I have at the moment. So once again, the guided markup walks you through the measurement and makes it very, very simple. So the first step is pick 3 points to fit a circle to the right femoral head. We're just creating a circle around the femoral head. Once we've done that, we can press next step. Now we're picking 1 point and dragging the line so that it just touches the acetabulum. So we can pick any point up here. And then just to make sure that that line just touches the acetabulum, we're going to do a next step. It now is asking for 3 points to fit a circle to the left femoral head. Remember to press next step whenever you followed the instructions. Now we're picking a point and dragging it so that it just touches the acetabulum. Let's pretty much that. And the software is calculating your left and right Norbert angles for you. Of course, as I said, positioning, we all are aware with the importance of positioning. And again, a reminder, if we want to now take these annotations off so that we can look at a clean radiograph but not lose the information, all we're going to press is blank markup. So other functions under edit, Measures and scores is where we will find any previous measurements, or, such as VHS or other angles or linear measures we've taken on that X-ray. Scores will give us, for example, your VHS result. Then there's another function called template. Template's very useful for surgeons. Essentially, the software has preloaded surgical instruments on the system. So they've got a TTA by Vet Instrumentation or Chiron, for example. And these, of course, need to be done on a calibrated image. But if, for example, we go to Chiron and we pick a 2 plate, for example, and add it, it will then give us an accurately sized plate that we can move around on our bones and be able to assess correct sizing and plan our surgery as appropriate. To delete, we can say remove all. And yeah, there's plates, forks, screws, and cages available. The Chiron and the Vet Instrumentation has a few different cages. It's quite a strength and quite unique amongst the veterinary DR softwares.